Doctor, you ready?
I'm ready.
And you can just square up with me.
Oh,
Yeah.
okay.
Right there. Yeah. Well, doctor, first of all, how's he doing?
Mr. Broomer's doing well. He's stable right now. He's currently in the ICU, but he's awake and talking and recovering well so far. He's in good spirits.
Nice. What's the biggest challenge moving forward for him?
At this point, it's just making sure that his wounds don't succumb to an infection. Um, but otherwise, his wounds were actually mostly muscle and subcutaneous tissue. There wasn't any organ damage or arterial damage or bone damage. So he got very, very lucky. Probably one of the luckiest patients I've seen in the last decade, honestly. But he just has to stay in good spirits and continue to heal.
How much worse could it have been?
It could have been much, much worse. He could have not made it out of the water. The injuries that he had were easy for us to fix, but if they had been much deeper, if it severed a major artery, he could have bled out in the water before I even get to shore. So it could have been much, much worse.
Wow. And is this like one of those things that we hear, oh, an inch away from an artery, a couple of inches away from a major artery puncture?
This was millimeters, a millimeter away from an artery. Actually, in one of the open wounds on his abdomen, you could see clearly one of the major arteries that feeds the leg on the right side, and that was clearly exposed as if a surgeon had dissected it. So this laceration was literally millimeters away from killing him.
And how many bites?
It appears, I'm not a shark bite expert, this is the first one I've seen, but it appears as if it was one bite, and then there were some lacerations on his left arm and hand, but the patient reported it was just one bite, and that's what it looks like examining him.
Did he give any, he's swimming, he's an avid swimmer, he's swam that mile for years, or that area for years. Did he give you any indication that he saw it coming, or he never saw it, never knew what was coming?
He did not say that he saw it coming at all. He just reacted to it once it happened, but he had no evidence that it was coming for him. He didn't see it coming at all.
And then doctor, I mean, a police officer responds, a surfer responds, a nurse. How key were those first responders in possibly saving his life? I mean, if you have a nurse on scene, I mean, that...
Yes, they were extremely helpful. They're actually the real heroes of the situation. Without someone on the beach ready to go out and bring him back in, and then people on the beach ready with tourniquets, he could have also lost his life just in that fact that there was no one available, or if there was no one able to bring him in, he could have died in the water. The bystanders were crucial in saving his life.
Jesus. What's ahead for him? Months, weeks of physical therapy? How soon could he walk out of here?
Yeah, he'll definitely have probably weeks to months of physical therapy, just to give time for all the wounds to heal and the muscles to get strong again. He will likely walk out of here, but he might walk to a rehab unit to do some rehab first. We'll see how he does.
So it's like nothing paralyzing, nothing like that.
Not that we can tell so far. He's moving all of his extremities. He can feel his feet. He can wiggle his toes, and he's doing well so far from that standpoint.
You guys patched him up. Are we talking like a lot of stitches here?
I didn't count the number of stitches exactly, but probably a few hundred at least. It was 2 hours of washing out and repairing the lacerations to his trunk, legs, and arm.
Maybe the last question, when he finally came out of whatever he was on, under, and able to speak coherently, what were some of the first words?
He said, "I was very unlucky, and then I was very lucky." It was one of the first things he said to me. He was actually in a very good mood considering what had happened the day before. This morning he was talkative and able to even talk about the experience, which surprised me. Something that traumatic, I would sometimes expect people not to want to talk about it right away, but he was feeling well and ready to talk, actually.
Doctor, anything else that I haven't asked that's maybe significant to the story, to his recovery, to his being attacked?
Sure. I think the other thing that's important in this story is that, having a trauma center here in Monterey was crucial as well. If he had to be flown up somewhere north, more transit time could have led to more bleeding and may have lost his life. So having a trauma center here in Monterey was also important to him surviving.
I'm surprised he wasn't air flighted, but that probably would have taken longer than just loading him up in an ambulance.
Yeah, sometimes it can, depending on the situation and the weather and all that. But luckily, we're a short drive with a quick ambulance from the Lover's Point, and I think that was probably the best thing for him.
I think we have an age of like 62.
Yes.
He's 62.
Yes.
And I mean, I'm sure he's surrounded by maybe, I don't know, friends, family, or mostly family?
Family I saw with him in the room this morning.
Did he mention anything about the fact that he's in this kelp crawlers swim club and that they swim regularly except on Wednesdays? But he told a friend he couldn't resist because the weather was so nice.
I hadn't heard that. He hadn't told me about that yet. Unfortunately, I didn't know that he doesn't usually swim Wednesdays. Maybe no more swimming on Wednesdays for him.
Yeah, he did say he swims like once or twice a week usually.
He does, yeah.
Once last week.
Yeah, he's a regular swimmer
Yeah.
for the last decade.
That route.
That actually was important too. The fact that he had a good cardiac reserve. He's resting a low heart rate like an athlete, and he was able to tolerate a larger amount of blood loss, I think, because he, had a lot of reserve in his cardiac function.
Were you,
Sure.
I mean, is it like, I mean, if I was to see like a bunch of holes in his, how would you just, what did you see?
So he's got a large U-shaped laceration that goes across his lower abdomen, around his left thigh, and then over the front of his left and right thigh, as if a giant jaw had crushed down around his pelvis, around his lower abdomen and upper legs.
Any idea how big this shark could have been?
Unfortunately, I'm not an expert in shark bite radiuses, but to me it looks pretty big. I'm not sure what kind of shark or how big the shark could have been, unfortunately.
Well, Fish and Wildlife today confirmed it was a great white.
Oh, wow.
I guess they took DNA from his wetsuit or something,
Yes,
and they sent it off and confirmed this afternoon it was a great white.
that's what I heard. Yeah, that's incredible. We gave his wetsuit to the Fish and Wildlife people when we cut it off him yesterday.